Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. March is National Kidney Month. Did you know that West Virginia has one of the highest rates of kidney failure in the country? And that kidney disease is among the leading causes of death for West Virginians. It's often called the silent disease because there are usually no symptoms during its early stages. So how do you know if you have kidney disease? What can you do right now to prevent kidney disease? We're going to answer those questions and more as we're talking about kidney disease and kidney transplants with Dr. Rajeev Sharma, transplant surgeon for the WVU Medicine Transplant Alliance. Welcome, Dr. Sharma, to Live Healthy West Virginia.
Thank you for having me. It's a pleasure to be here.
We're happy to have you here. So I did a little bit of research. The National Kidney Foundation estimates 37 million Americans have kidney disease, and nearly 4,000 West Virginians are living with end-stage kidney disease. So let's start with, what is kidney disease?
To understand kidney disease, you have to understand what the kidney does and the function of the kidney. Most of the people think of kidney just as a filter, but it actually does a lot more than that. It not only filters the blood and removes the toxins and secretes them in the urine, it also maintains the homeostasis in the blood, which is the balance of salt, water, and electrolytes in your blood. It also produces certain hormones like renin, which regulates your blood pressure. It produces hormones like erythropoietin, which stimulate the bone marrow to produce more red blood cells. It also maintains the calcium and phosphate balance in bone health. So it does a lot of things other than just filtering the blood. So any structural or functional abnormality in the kidney can lead to kidney disease. The commonest kidney disease that we see in the transplant population are diabetes and hypertension.
Oh boy, we've got a lot of that in West Virginia.
Yes. Then there are other congenital and acquired conditions like polycystic kidney disease, certain autoimmune conditions like lupus that can hurt the kidney, and even certain drugs like ibuprofen, which falls under the broad category of NSAIDs, the non-steroidal anti-inflammatory drugs. Prolonged, persistent use of those drugs can also cause kidney failure.
So it's called, kidney disease is known as the silent disease because early on, there aren't really any symptoms. So how can you tell if you have kidney disease?
Yes, that is true. In 90% of the patients, there are absolutely zero symptoms until it is fairly advanced. So it's very difficult to pick it up early unless you have your annual health checks and you're getting your blood test and urine analysis, then where you could get some hints if you have an underlying condition, and then you could get investigated for those. So the earliest symptom is generally tiredness. But other than that, most of the patients, until they have fairly advanced disease, will have no symptoms at all. So it's important to have a primary care physician, and it's important to do your annual health visits so that you can pick things early.
Wow. Okay. Are there any symptoms to look for as the disease advances? I know it's like almost too late, but what can we look for as it advances?
So as it advances, you'll have symptoms related to mainly fluid buildup in the body, because now kidney is not removing the excess water. So patients are going to have swelling of the legs. They're going to have shortness of breath with exertion because of the fluid buildup in lungs. They will also have itching. They'll have difficult to control high blood pressure. So all of those things, including congestive heart failure, can happen in advanced disease.
So who's most at risk for getting kidney disease?
So anyone at any age can get kidney disease.
Wow.
In certain medical conditions like diabetes or hypertension, you're at a higher risk.
Okay.
1 in 3 patients with diabetes and 1 in 5 with hypertension will have kidney disease. Certain minority populations have a higher risk. So African Americans, 16% of African Americans will have kidney disease, 14% of Hispanics, 13% of Asian Americans. In minority populations, it's also related to access to healthcare for these patients. It's also related to age. So if you're older than 65, there are 38% patients older than 65 in the US who have kidney disease.
Wow.
All of these things taken together. Now, if you are African American and if you're older than 65, there's a much higher likelihood that you will have kidney disease.
So you should be on the lookout.
Yes.
Okay. What are the treatment options for kidney disease?
So it's treating the underlying cause. So if you have diabetes, you need to be meeting with your endocrinologist and have a very good control of your blood sugar. If you have hypertension, again, very good blood pressure control will prevent the progression of chronic kidney disease. So treatment of the underlying condition is what will prevent progression of kidney disease.
You can't reverse it, though.
No. So the damage is permanent. The damage to the nephrons is generally permanent. So in end-stage kidney disease, the treatment options are dialysis and transplantation.
Okay. So dialysis or transplantation. Let's talk first about dialysis. If you have to go on dialysis, what can you expect?
So for almost everyone who starts dialysis, it's a profoundly life-changing experience.
Oh, yeah.
There's a lot of anxiety associated with it, basically the fear of the unknown. So very good education of the patients before starting dialysis is paramount to prevent anxiety related to that. But once you start dialysis, you have to look at options of hemodialysis versus peritoneal dialysis. In hemodialysis, you first have to visit a surgeon who will either put a line in the neck or will create a connection between an artery and a vein, either in the hand or in the legs, through which you dialyze. You go to a dialysis center for 3 times a week, and you're hooked up to a machine for 3 to 4 hours in each session.
That's a lot.
Yes. The machine does the work of the kidney, so the machine will kind of filter your blood. You can also do hemodialysis at home now, but that requires the patient or their caregiver to be well trained and comfortable with it. So a lot of patients are doing home hemodialysis, which is easier because now you don't have to go to a dialysis center and it doesn't interfere with your work life. You can continue to work and dialyze at the same time.
Wow.
But hemodialysis is, as I said, is a life-changing experience. And the commonest thing that I hear from the patients on dialysis is that they feel that on dialysis days, they're completely drained of all energy that they have. Tiredness, profound tiredness on dialysis days is what they experience. Plus, you're removing a lot of excess fluid on dialysis. So as a result of that, you could have dizziness, hypotension during the dialysis itself. So that is hemodialysis.
Okay.
Now, peritoneal dialysis is the other option. Peritoneal dialysis is easier on your body. For that, also, you have to first visit a surgeon who will place a tube in the abdomen inside the peritoneal cavity through which you will dialyze. You dialyze at home. So you instill a dialysis solution through the tube inside your peritoneal cavity, and you allow that fluid to stay for some time. Then peritoneum, which is the membrane that covers the abdominal organs, it acts as the dialysis membrane across which fluid exchange will take place.
Oh, okay.
And so once that exchange takes place and the blood is filtered, the waste is then drained out through the same tube. Patient does all of this at home.
That sounds complicated, though.
It's not as complicated as it sounds. The process is complicated, what's happening in the peritoneal cavity, but for the patient, it's just instilling fluid through the tube and allowing the fluid to drain back. That's all they have to do. And it's much easier. You don't get those episodes of hypotension that you would get on hemodialysis. And you can do this at home at night, so it doesn't interfere with your work life.
Okay. And that's a newer option, isn't it?
No, it has
Newish?
been around. No, it has been around for a long time. So these are the options that patients have to choose from. There wasn't as much emphasis given on peritoneal dialysis earlier, but now more and more nephrologists, they want their patients to have peritoneal dialysis because of patient choice, just because it is easier.
It is easier.
Yeah.
Well, that's good to know that there's that option. Okay, so the only way to get off dialysis is to have a kidney transplant. So let's talk about kidney transplants. How many people, first of all, are on the transplant list, and how many of them are waiting for a kidney?
Yes. So I can tell you about the kidney transplant list. So as of yesterday, UNOS had about 87,000 patients waiting for a kidney. But that number varies between generally around 90,000 to 100,000 a year.
And that's nationwide?
Nationwide.
Okay.
And of whom only about 25 to 27,000 people get a kidney every year.
Oh, wow.
In 2023, 27,000 people received a kidney transplant in US. So 27,332 is the exact number.
So about
huge
about
imbalance
2/3
between, yes,
are not going to get a transplant. What's the average wait time when you're on the donor list?
So average wait time depends upon the region that you're in. It depends upon your blood type. So for our program, our region, the average wait time is about 36 months of waiting
3 years.
time since that. So the waiting time starts from the time you started dialysis. So if you started dialysis 2 years ago, but you're listed today, you are listed with 2 years of time.
Oh, okay. Does it kind of put you further
Yes,
up on the
it
list?
does. It
Okay,
does.
okay. All
But
right.
the time also varies by blood type. Blood type O and A have the longest wait time. So the
Because there's
36
more
month-
demand for that.
They're the more common blood type. So
Okay.
when you average everything out, it is 36 months. But when you look at blood types, for blood type O and A, it might be greater than 4 years.
Oh, wow. Wow. So are most of the donors for kidney transplants, are they most of them living donors, or are most of them deceased donors?
So majority are deceased donors. So I can tell you 2023 data. So 27,000 kidney transplants performed in the country, of which 21,000 were deceased donors and only 6,000 were living donors. So significant proportion is deceased donors.
Okay. Now, here at the WVU Medicine Transplant Alliance, we are soon going to be doing living donors.
Yes.
Can you talk a little bit about that?
We were recently approved for living donation, and we have started evaluating patients. We have started getting referrals for living donation, and we hope to start doing the living donors very soon.
That's great. So let's give people some information on being a living donor. I mean, first of all, I know the first question would be, can you live a long, healthy life with one working kidney if you donate one of your kidneys?
Yes, you can live a perfectly normal life with one kidney as you can with two. If you're generally, age is not a criteria, but generally, if you're less than 65, if you have a body mass index that is less than 35, if you don't have diabetes or any other chronic medical condition that can hurt your kidney in the long term, if you have hypertension, which is controlled very well with a single medication, you could be a donor. Blood type generally doesn't matter anymore because of the availability of paired exchange. So if you have a donor that is not blood type compatible with you, it's possible to find a donor somewhere in the country that has the compatible blood type, and your donor can donate to someone else.
And then, like, you swap donors?
Exactly. So
Oh,
that's called
wow.
paired exchange.
I didn't know you could do that.
Yes. So as long as you have a donor, there is a possibility that you can get a living donor kidney. And living donor kidneys, they do better. They work right away after transplant. They last longer than deceased donor kidneys. So it's a better option.
So there's some options there. That's great.
And regarding living donors, I would also like to point out that the incidence of end-stage kidney disease in living donors is less than that in the general population.
Oh, wow.
Which is kind of counterintuitive.
Yeah, you wouldn't think that. Yeah.
But that is because the living donors undergo very rigorous workup. So any medical conditions that they may have are discovered early and managed, so they don't progress to advanced stages of disease. So the incidence is slightly less in general population when compared to the living donors. But if you compare healthy general population with healthy living donors, there is a higher incidence of end-stage renal disease in living donors.
Okay. All right. Well, that's good to know too. How easy is it to register to be an organ donor? How do we become organ donors?
Yeah, it's very easy. Like you can register at DMV. You can register when you're getting your hunting or fishing licenses. You could register on WVU Medicine. There's a website called registerme.org/WVU Medicine. So there's simple ways to register to be a donor if you want to be one. You should be one. It really profoundly impacts the life of so many patients, so many people. Just one person donating, their organs can save several lives. By several lives, I mean it's not just the 8 organs that you can donate. You also donate the skin, you donate the tissue, you donate the cornea. So you can impact many lives, like 75 lives is generally what,
with one donor.
With one donor, yeah.
Wow, that sounds like it goes a long way.
It does.
All right, well, if we're talking about being a donor, we got to do some myth busting here. Now, I know that there are some people there, they may be hesitant to become a donor because they think, oh, but if I'm afraid that if I get really sick, the medical staff is not going to do everything they can to save my life if they know I'm an organ donor.
Yeah, I've heard that
it's common.
From patients as well, but that's absolutely not true. This field is so heavily regulated. Very strict criteria have to be met before you could even pursue donation in someone with end of life care. So you have to meet criteria for brain death, and those criteria have to be cross-checked before you determine that someone has brain death. So you can donate following brain death. You can also donate following circulatory death, but again, certain strict criteria have to be met and cross-checked, then you donate. So it's absolutely not true that the staff will not care for you if you have a critical, life-threatening medical condition, and they will simply pursue donation. No, that doesn't happen.
Is there a possibility, if I'm signed up to be an organ donor, if my family doesn't know about it, can they veto it, for lack of a better word?
Yes, it does happen. And it does happen. In those cases, you have to go to the ethics committee, and sometimes even, you might have to seek the help of a judge if the person is a first-person donor, registered to be a donor on the license, and the family does not want to do that. So it becomes complex.
So if we're a donor, we want to be a donor, we should tell our family.
Yes.
So we can avoid all that.
Explicitly clear that, if you're a donor, you want to donate, let your loved ones know that.
Good to know. Good to know. Can you be too old to be an organ donor?
So there is no strict age cutoff. However, the caveat is if you're older than 70, then the glomerular filtration rate, kidney function, it's a function of age, along with certain other metrics. So as you grow older, your estimated glomerular filtration rate, that's a function of the kidney, keeps declining. So above 70, most of the patients would not be very good donors. So a lot of the kidneys that are recovered from donors over the age of 70 end up being discarded because they're not considered suitable for transplantation. But for living donors, again, there is no age cutoff, although 65 is an arbitrary guideline. In my experience, I've taken a kidney from a donor that was 74-year-old. It was a couple, husband-wife. Husband wanted to donate a kidney to his wife, and he donated it on her birthday. It was
Oh my
a
gosh.
74-year-old couple, and they both did very well.
Wow. Well, that gives people hope too. That's good to know. Now, this is like a fun fact to me. I think this is really fascinating. I found out that, now this is true, right? That when you do a kidney transplant, you don't take out the non-functioning kidney.
Yeah.
You just put in the healthy one. So you have, if you get a kidney transplant, you're going to have 3 kidneys there.
Yes, that's absolutely right.
How is that possible? How's there room for all that?
Actually, when the kidneys, they stop working, they atrophy. They become smaller in size.
Okay.
And we normally place the kidney in the lower abdomen, just above the groin. And you end up with 3 kidneys. The kidneys are only removed when they're too large, like in patients with polycystic kidney disease, where there is no room to place a new kidney. Then we take the native kidney out and put the new one in. But otherwise, you don't have to take the old ones out. They just atrophy and sit there, very tiny little calcified organs.
They can all live together, and you can live a normal life.
If you need a second transplant, you're going to have 4 kidneys.
Oh, gosh. Wow.
Yes.
All right. Well, I believe you if you say you can make it happen. That's interesting. So I always like to ask before we go, what's the most important thing you want our viewers or listeners to know about kidney transplants and registering to be a donor?
So regarding registering to be a donor, as I said, register to be a donor, let your loved ones know that you're a donor. You can profoundly impact so many lives. So that is very important. And there are easy ways to register, as we discussed earlier. And regarding transplant, I would like to talk a little bit about what we are doing here in our transplant program.
At the WVU WVU Medicine Transplant
Yes.
Alliance, yes.
So there are certain barriers to transplantation. We are addressing those barriers and trying to come up with innovative solutions to transplant the patients who are not otherwise offered transplantation because either they have a severe cardiac disease, pulmonary hypertension, frailty, morbid obesity, behavioral health issues, or severe vascular disease. That is another of the common barriers. So we run this program in partnership with nephrology, and we have collaborated with other specialties within WVU Medicine to try and address each of these situations. So we have very strong collaboration with cardiology, and we have a good heart and kidney transplant program.
Yeah.
We have collaborated with vascular surgery and intervention radiology for the severe vascular disease patients. We have collaborated with behavioral health for patients with severe mood disorders and compliance issues. We have collaborated with weight management and plastic surgery for patients with morbid obesity. So we are kind of trying to remove all the barriers and improve access to transplantation for our patients. In doing this, most of the patients that are now not listed for transplant, we are also asking them, their nephrologist, to come back so that we can reassess them.
Take another look.
A lot of programs have BMI cutoff of 40. We do not have a BMI cutoff in our program. A lot of programs have a BMI age cutoff of 70. We do not have an age cutoff in our program anymore. So we are bringing all the patients and evaluating them on a case-by-case basis to see if there is something we can do to help that can realize their dream of transplantation rather than being on dialysis for the rest of their lives.
Make it more accessible.
Yes. And we have recently also started HIV transplant program. So we have started evaluating patients who have HIV for kidney transplant. Not all transplant programs do that.
Oh, wow. So you really are trying to make this accessible to as many people as possible.
Yes, West Virginia is number one in a lot of health conditions like obesity and other things. So we have a population that is very sick, and we're trying to basically cater our services to be able to help the people here.
Okay, great. Well, thank you so much for sharing this information with us today. I mean, it's always interesting, and it's such a good cause, to encourage people to become an organ donor and give hope to those that need one.
Absolutely. Thank you for having me.
All right, great. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about kidney disease and kidney transplants, visit wvumedicine.org/transplant. And we encourage you to register to become an organ donor by visiting registerme.org/WVU And to find the latest episode of this podcast and all of our episodes, they live at wvmetronews.com/podcast. I'm Mary Ravazio Menard, and on behalf of Dr. Sharma and everyone at WVU Medicine, thanks for joining us.